These are the steps to the prime skin peel. Now, before starting the peel, the therapist will need to remove any makeup a client may have on the skin, as well as moisturiser, SPF, or any excess oils. If they are wearing spray tan, they must not pursue the treatment, as this will draw out any colour in their skin and it can cause hypopigmentation. Please advise the client when booking in that they must not have any spray tan on the skin, any recent sun exposure, as well as sunburn. Once you have consulted with the patient, tell them the steps in which you're about to adhere, so that they know what to expect, what they can do and what they can't do during the peeling process, and of course aftercare. What you can see here is the application of green juice balm. This is applied with a cotton tip around the eyes, under the nose and on the lips. This is used as a protective barrier, and these are sensitive areas of our face in which we do not want the peel to penetrate. For example, if the peel hits the lips, it can and cause blisters as it's a membrane skin. Next, you will need a glass or a porcelain bowl. Apply the peel to the gauze by placing a small gauze in a bowl and soak the gauze. Squeeze out any excess gently, but enough to make sure the skin has a wet look amount when applied. Make sure you have a fan handy, as the peel is very hot and the client knows where they are and are not feeling the heat, so that they can fan their skin at any time and feel more comfortable. The next step is to apply the peel to the skin gently, making sure it is covered and has a wet look so that you know enough has been applied. Encourage the client to use the fan to keep their skin cool. This will also help the frosting process happen quicker. Make sure you ask your client during the treatment if they are comfortable, and do not leave the room, as you need to watch the skin the whole time and make sure that the client is comfortable throughout the treatment. As you can see, redness and frosting is beginning to take place on the client's skin. Once the peel is dry, you can reapply to the skin. It is normal for the skin to experience erythema and frosting. We always explain to the patient that frosting is what we are wanting to achieve, so at the end of the treatment they do not stress out when they see whitening to the skin. Once an area is frosted over, you can cold compress the area just using Fibrella or sponges to deactivate and change the pH level of the skin so that the peel will not penetrate any deeper. If other areas are not frosted, you may continue use of peel until the end point is achieved in those areas. Now, what you can see is the skin has considerably frosted over and has quite a lot of erythema. This is normal. We will check over the skin to make sure the patient will get the best out of her results and reapply the peel in areas only which have not frosted over. This will make sure the peel has given an even response in all areas so that the client will get the best outcome out of her treatment. skin has frosted over considerably, it has reached an end point. As you can see the whitening on the skin and the erythema, this peel is ready to be removed. We use a cold compress to deactivate and remove any excess peel before cleansing the peel off. You may use sponges or fibrellas, and this can be performed by soaking in water and squeezing out any excess water and compressing to the skin gently. Using a gentle cleanser, you must foam it up in your hands and only pat the cleanser on the skin to remove the peel. If you do use circular motions, it may cause epidermal sliding, and the client is very uncomfortable at this point, so you need to be very gentle. You must also stress this to the client that they can only pat the skin when cleansing at home and drying the skin. You must then cold compress the skin using fibrella or sponges. No circular motions. Once peel is removed with the sponges, you may then use a cold towel for the patient's comfort as their skin is feeling like it's very hot. The very last step is to apply green juice balm all over. This instantly soothes the skin and reduces frosting and redness. This is done once again by patting into the skin. Your client may want to lay there for 5 minutes with the balm on while their skin calms down. SPF is to be applied directly after if it is performed during the day. Remember to remind your patient of all aftercare and send them home with an aftercare sheet.